Imagine waking up one day to hear someone you love has suffered from a serious stroke, a stroke that could have been prevented if they knew they had atrial fibrillation. This condition affects the heart, which causes an arrhythmia. This arrhythmia can lead to blood clots, and blood clots can lead to a stroke. I am currently a nursing student, and I have researched this topic in depth based off credible sources and interviews. This is relevant to all of us because atrial fibrillation affects 2.7 million Americans, and that number continues to grow. To recognize AFib, another term for atrial fibrillation, one must understand the basic concepts of the condition that can help them later understand the causes, the symptoms, and the treatments much better. To understand the basic concepts of atrial fibrillation, it says, according to American Heart Association, it is the abnormal firing of electrical impulses in the heart that cause the atria to quiver. Basically, this is the sloshing noise that one can hear in the blood in the heart when the blood is trying to leave from the atrium to go to the ventricle. I spoke to a pharmaceutical sales representative, Jeannie Kunin, who sells medicine to help deal with blood clots and atrial fibrillation. She says that this condition typically forms in the left atrium. She also states that atrial fibrillation is known as an electrical problem from the heart being out of sync, just like how cholesterol buildup in the heart is like a plumbing problem. So basically, I want everyone to understand that atrial fibrillation is an electrical problem, and that means that blood cannot fully leave the atrium to go into the ventricles. Now that one understands AFib, they have a better understanding to what the causes can be. And many of these causes can be based off genetics and lifestyle factors. The Mayo Clinic website states abnormalities and damage to heart structure are the most common causes. Basically, you can get from this that damage from injuries or abnormalities from genetics of the individual are the most common causes. They also state that the older someone gets, the more likely they are to get atrial fibrillation, just from the basic wear and tear on the body that someone sees. An article by Anne Pierangelo backs this up and reports that 70% of the people who get atrial fibrillation are ages between 65 and 85. She also states that men are more likely to get this condition than women are. But there's also the lifestyle factors that play a key role in atrial fibrillation, such as obesity being a major impact. A study by Chris Eliadis says that women who are obese are at a 41% higher risk to get atrial fibrillation than women who are not obese. He also includes that the pressure in the blood vessels in the lungs, which lead to pressure in the heart, causes the heart to stretch, and that causes the atrial fibrillation and the arrhythmia. Other factors that can be attributed to this are alcohol intoxication by binge drinking and stress. Now, a person may not be able to change their genetics, but lifestyle factors they can change, and they can live a healthier life, and that can help lower their risk. Promptly knowing the causes of the condition, one must understand and be able to identify the symptoms that they may be receiving from this condition. Now, there are many different symptoms that someone can experience, and diverse people can experience very different things. From the paper in the Journal of the American Medical Association, Amy Thompson says doctors can use physical examination or electrocardiograms to detect atrial fibrillation. The most common symptom that people see from atrial fibrillation is the quivering or flooding heartbeat, as indicated by the American Heart Association website. But also, Thompson says that some persons may not even have symptoms at all and be asymptomatic. And they don't even know that they have it when they're asymptomatic. I found some real-life examples from the American Heart Association that one can identify with. One example is they say that their heart flip-flops, skips a beat, and bangs along their chest wall, especially when carrying things up and down stairs and when they're bending down. Another person states they feel nauseated, lightheaded, and weak. They have a very fast heartbeat and they feel like they're gasping for air. The last person states that they had no symptoms at all and that it was discovered at a checkup and that they were very happy that they found it early on. So this is important to understand that symptoms vary, and it's important to get checked even if you have no symptoms at all. And once the symptoms are found, a treatment will be put in place for one to pick from. And there's many kinds of treatments, and there's different approaches for different patients. The most common treatment that people see is medications, such as Eliquis, warfarin, Coumadin, Pradaxa, and Xarelto, and each of these have their pros and cons. For my interview with this pharmaceutical sales representative, she states that Eliquis focuses on one specific factor of the coagulation cascade, and this allows for blood clots to not form. However, they have to take this pill twice a day. Whereas she also explains that Xarelto is only once a day, but they have a higher chance of a GI bleed. So an individual has to decide what works best for them and based on their condition and their lifestyle. And then there are other types of treatment, not as common as medication, but they're such as ablation, as explained by Thompson, whereas it's small electrodes used to scar the tissue that generates these abnormal signals in like the atrium. And then this scarring will hopefully return the heart to a normal rhythm. There's also cardioversion, where described by Mayo Clinic as electrical signals to stop the heart and then start it up again, and hoping that once the heart starts up again, that the heart will go to a normal rhythm. And then there's a pacemaker, where the doctor basically damages the AV node, which is in the atrium, and that stops the arrhythmia, and then the pacemaker gets put in place to help correct that arrhythmia, and it's at a normal pace. Lastly, one can just lower their risk by basically living a healthier life and having a healthier lifestyle, by losing weight and exercising, even eating a healthy diet. It's also important to avoid alcohol and smoking, which is also always beneficial. Now, these various types of treatments allow patients to decide what they believe is the best option for them. To conclude, atrial fibrillation is a common condition but unheard of. Now you have a better understanding of what atrial fibrillation is. Now you're at a better advantage to identify it before it becomes a problem. And it may not be as severe as it seems, but it leads to many serious conditions, even death. And you don't want someone you love with this condition and leaving it untreated. So knowing the basics will help you and the ones you love for right now and for the future. Thank you.